Okay, we want to thank everyone for joining us today, especially the folks that you see standing up here on stage with me. Let me quickly run through the people who will speak and thank those who won't be speaking but considered it important enough to be here as well. Because what we're talking about today is the well-being of hundreds of thousands of Californians, actually hundreds of thousands, if not millions of Americans across the country. And so this is important. And the people that you see here are the ones that allow so many Americans to live in dignity and have the opportunity to be at home, to be serviced, to live a life, to be with their loved ones. And in so many ways, it's the kind of thing many of us just take for granted. We can't take it for granted. And that's why today's announcement is so important. Let me introduce the folks who are with us first, and then I'll go through, explain what we are doing. I will begin by recognizing the people who will speak. April Verrett will be speaking right after I speak. She is the president of SEIU Local 2015. Christina Boz Hamilton is the legislative director for UDW AFSCME, that's AFSCME Local 3930. Andrea Dudley, in-home support services provider. Her son is here with her as well, and she is a member of AFSCME's UDW Local 3930. Anjanae Ward, forgive me, Anjanae Ward, who is also a provider, an IHSS provider, and a member of SEIU 2015. With us as well are some of my team who have made today's announcement possible. Anna Rich, who is a Deputy Attorney General, Kathleen Borges, Supervising Deputy Attorney General, and Melanie Fontes Rayner, who is a Special Assistant to the Attorney General. There are other folks who are here, and as I said, I want to thank them for taking the time to be here with us. Last week, the federal government issued a final rule that interprets the Medicaid Act and takes away rights from our states to operate our home and community-based care programs to meet the needs of our people in our states, the unique needs of the people in our states. The federal government did this by rescinding our ability to deduct voluntary union dues and health care benefits from the paychecks of home care workers. In California, Medi-Cal, which is our Medicaid program, prioritizes home and community-based care through the In-Home Supportive Services, or IHSS program. It provides support care for 460,000. It provides support care by 460,000 workers. They, in turn, care for the numerous Californians who are seniors or people with disabilities who access this care and deserve our protection. That's why today I am filing a lawsuit against the Trump administration, along with a coalition of other states, Oregon, Washington, Connecticut, and Massachusetts. The 5 states, we are suing the federal government for trying to enact an unlawful rule which would damage not just the workers who provide in-home supportive services, but the very people who are in need of those in-home supportive services. This new Trump rule is a solution in search of a problem. The rule from the Department of Health and Human Services contends that it is overturning a previous rule by the federal government, by the Obama administration. That was issued back in 2014. That rule in 2014 allowed workers to authorize that part of their paycheck be directed to cover their health care benefits and other benefits and their union dues. This administration is trying to prevent the efficient direction of resources that each and every worker who collects that paycheck is entitled to do, just the way you and I right now may direct some of our paycheck to be used to pay our health care benefits or for our retirement benefits or for any other purposes. So long as we have voluntarily agreed to do that, it is our right, since it is our money that we earned, to direct that money. the federal government under the Trump administration is trying to deny those more than 460,000 workers in California and more workers across this nation that same opportunity to do what you and I take for granted. These benefits and voluntary union dues that workers have been paying have been deducted, at least in California, from the paychecks of these workers since the 1990s without there ever being an issue. Yet this Trump administration rule is a backdoor way of making it harder for home care workers to get their hard-earned benefits and to organize as a union.
That's right.
It once again shows the reckless disregard this administration has for people's health care and for workers. It's a short rule, but it would have a huge impact on California's home care workers and the more than 560,000 Californians who rely on those workers every day for help taking a shower or taking their medicine or for rides to doctor's appointments. You name it, they do it. They do it for your mom, for your son, for your aunt. They do it for your disabled loved one. They do it for that senior who can no longer get along without that help. And they do it in a way that helps Californians protect its people and also make sure that we do it cost effectively. These home care workers are the people who make sure our aging parents are eating well, that they are living in clean, safe conditions, and they're help Californians who have disabilities navigate their day-to-day lives and the complex healthcare system. Historically, most of these in-home supportive services workers had undertaken this difficult task, often physically demanding work, and were rarely rewarded for what they did. They usually worked for very low wages, very few benefits, if any, frequently injured, and they worked unpredictable hours. And because most of these workers worked alone in separate, unregulated environments, they had almost no ability to advocate for themselves and to advocate for their rights. That changed when workers started to come together, to unionize, to collectively bargain, to help each other have rights, to help each other get the kind of pay and benefits they deserved, to let them be able to reach out to others, to let them know they too could work under safer conditions with better pay. This ability to collectively organize has provided home care workers with better regulating processes. It has provided them with training, and it has helped them receive benefits. It has created a more stable workforce that can better provide for our elderly and people with disabilities and our young people who have disabilities at so young an age. And it provides them with the care that they need in their homes and in their communities. And it has reduced costs for the state by avoiding unnecessary institutionalizations by keeping people healthy and at home. Home care providers across California have voluntarily chosen, for example, to have union dues deducted from their paychecks. And they are primarily represented by SEIU Local 2015 and AFSCME United Domestic Workers who are with us here today. These two unions have made it possible for workers to work in dignity, to be able to get paid a better wage, and to have benefits, and to be able to organize to help others. More than half of the IHSS workers elect to join unions and to pay their union dues through a payroll deduction. And I want to be clear, these deductions are only made from paychecks of people who have chosen to join a union. That's why this rule is an attack on that choice. It will disrupt these unions and the care their members provide in monumental ways, hurting not just the home care workers, but the elderly and the disabled in California as they try to go about their work and their lives every day. In theory, states could avoid that disruption by foregoing Medicaid federal funding for personal care services that allow people to stay in their homes and their communities. In reality, that would mean forfeiting more than $6 billion here in the state of California of federal funds, which come through the taxes that each and every one of us pay. And so why should we forego money to do this service the right way when we pay for it through our taxes? It would cause devastating harm to state health care budgets, and it would leave people relying on care without the types of protections that we see as a result of the work that's been done by the many unions and the state working together. That is not an option in California, not for these workers, not for the people they care for, and not for the state of California. We have a responsibility to these workers and to the people they care for to fight back when their rights and their health care are at stake, and the California Department of Justice will fight back. That's why we're here today, to file this lawsuit, to fight for those who fought for their rights as workers, to fight for those who need those workers, to fight to make sure California does this the right way, because we don't intend to backslide and do it the old way. We intend to do it better, the new way, and we want to have people join us. In California, we think it's important to move forward, not go backwards. With that, I want to now allow April Verrett to say some words, and then after she speaks, I will make sure that Christina Boss Hamilton will have a chance, and then Andrea Dudley, and then Anjanae Ward. April.
Thank you so much, Attorney General Becerra. Good morning, all. As the Attorney General said, my name is April Verrett, and I have the distinct pleasure to serve as the president of SEIU Local 2015, where we represent over 385,000 long-term care workers across the state of California. On behalf of our membership, I want to thank the Attorney General for taking the lead on this action against this hateful federal rule that targets home care providers, and for being a voice for home care workers, not just here in California, but across the nation. We know what this CMS rule change really is, so let's call it what it is and be plain. It is a shameful political attack on home care providers who are largely women and people of color. It's an attempt to silence their voices and to steal their power. Ever since home care workers organized here in California, they have fought hard to bring dignity and respect to the important work that they do while caring for our seniors and people with disabilities. Together, home care workers have won improvements to their working conditions and have played a key role in helping raise the minimum wage in the state of California so that all low-wage workers are on a path to $15 an hour. Together, home care workers have helped to improve the care and access to care that our most vulnerable residents need. And together, home care workers across California and this country have become a powerful political voice, fighting to protect workers' rights and to hold the government accountable to doing what's best for working families, our seniors, and those with disabilities, not corporate interest. Because of what home care workers have done together, they have achieved this by standing together, united with our sisters and brothers in UDW and others across the labor movement. Home care workers have become a threat to the current presidential administration, and therefore they have become a target like other women and people of color. Rather than applauding home care workers for what we've achieved, to bring dignity and respect to this work, this administration has chosen to shamefully take steps to silence us, to silence those who are doing God's work by caring for our parents, our grandparents, and our loved ones. Attorney General Becerra, again, we want to really sincerely thank you and the other AGs across the country who are a part of this action to stop this rule from taking effect. We want to let you know that long-term care workers across this country stands with you, and we will continue to fight until we prevail. Thank you.
Christina?
Oh, excuse me. Right up here.
Good morning. Thank you. Good morning. Thank you, Attorney General Becerra. My name is Christina Boss Hamilton, and it is my honor to serve as the Legislative Director for UDW, the United Domestic Workers, AFSCME Local 3930. We want to also convey our deep appreciation to the Attorney General for his strong opposition to this new rule. It is 100% appropriate to say, as Sister April said, that home care workers do God's work. We often repeat that when we are out in the field representing these folks. Our members do some of the most physically and emotionally demanding work that you can do, and often for poverty wages and little benefits. IHSS providers are entrusted with caring for low-income seniors and people with disabilities so they can remain in their homes with independence and dignity, which is ultimately what we all want for ourselves and for our loved ones. Yet instead of recognizing the value of the work that they do, the work that really lets the rest of us go to work and contribute and have economic value, instead of recognizing that value, year after year, we see concerted political attacks at the federal level to destroy our ability to come together and organize for better wages and working conditions. In addition to that, our members have organized to protect the IHSS program. That is probably just as important than the work on wages and benefits, is protecting the funding for the program itself, which is a Medicaid-funded program, and also consequently always on the threat for budget cuts. What the wealthy anti-union backers of this rule don't understand is that home care workers are by nature resilient, tough, and used to confronting obstacles and getting over them. That's what they do every day in their job. Instead of recognition for the value of our work, we see repeated concerted attacks. After the Harris versus Quinn Supreme Court decision in 2014, anti-union forces celebrated because they thought we were just going to roll over and wither away on the vine. What they didn't expect was that we would actually grow our unions, that we would actually sign up new members and even become more powerful. What they don't understand is that these attacks have motivated us to grow our membership and our political power. IHSS workers deserve recognition, respect, and honor, and we will continue to organize to protect our families and our loved ones and our union. Thank you again to Attorney General Becerra and to our allies around the country who are standing with us to stop this rule from taking effect. Thank you.
Good morning. My name is Andrea, and I am a home care provider and a member of my union, UDW. I care for my 12-year-old son, Logan, who has autism, and I joined the union because I wanted the support and the guidance of other home care workers. It's very important. And as a union, we have helped each other navigate through IHSS. We help each other avoid timesheet violations and to get the right amount of hours for our clients. We get a variety of members and benefit discounts through our union that help us make ends meet and help us to care for our families. And most importantly, when home care workers join together in a union, we can fight together to protect IHSS and seniors and people with disabilities that it services. My son needs full-time attention all the time. This is not a temporary situation for us. He's in it for the long haul. My union has given me support that I desperately need. I've learned that I'm entitled to by being with my union, and I've learned how to utilize this program. My son, he deserves the very best possible. When I joined my union, I did it from my own free will. It was my choice. And it was my choice to have my dues conveniently withheld from my paycheck so I didn't have to worry about my membership lapsing and losing access to my benefits. The CMS rule has changed, and it's insulting. It's personally insulting to me. We deserve the same rights as other workers to have our dues and other payments paid automatically. They're not doing this to protect me. They're doing this to make it harder to pay my union dues. This rule also changes the effect of health insurance premiums I have deducted from my paycheck, and that could put my health care in danger. I can't have that. Home care workers provide a critical service that allows people to be cared for in their homes instead of expensive institutions, and the federal government should be grateful for us.
That's right.
We are low-income workers, mostly women, people of color. Many of us are immigrants. Bullies always start with who they think are the weakest. And that's what's happening here. We're being bullied. That's why I'm so proud of California Attorney General Becerra. You're standing up for bullying. Our state knows that the federal government is trying to do to us. We're proud to join them in the fight, which is this attack on us and our clients. This rule change is about one thing: attacking unions. And the people behind it don't care who they hurt, as long as they score some political points. But these bullies, they picked the wrong fight this time.
That's right.
I've never met anyone tougher than a home care provider. And we're not backing down. So I say on behalf of the 110,000 UDW caregivers, thank you. Thank you. Thank you, Attorney General Becerra, for doing the right thing and defending the rights of home care workers and those we care for. Thank you so much.
Good morning. My name is Anjanae, and I'm a home care provider from San Joaquin County. The work I do as a home care provider isn't easy, but I love what I do. I love that I get to help people. It's my passion, and it gives me great satisfaction to know that I'm changing lives daily, helping the most vulnerable people in my community who are unable to help themselves. Because of home care workers like me, our seniors and people with disabilities are able to live at home where they want to be. For far too long, home care workers have been undervalued and a misunderstood occupation. I never thought I'd see the day when home care workers would become a political target, but we have. Our administration is uncomfortable with the voice and power of the thousands of home care workers across the country who are affected by this CMS ruling. However, I will tell you one thing: home care workers never back down. We fight for what is right. We fight for our families. We fight for our clients. We fight for our rights, and we will always have a seat at the table.
That's right.
And we're standing here with you, Attorney General Becerra. When we fight back against this Trump administration's attacks on the rights of caregivers, we will win. On behalf of all of home care workers, on behalf of myself and all home care workers across the state, we genuinely thank you. Thank you.
So as you can see, this is going to be an easier fight than some of the others I've taken on, because I have folks with me who understand this, because it's not a choice for them. They want to, and by the way, you don't get rich doing this work. Let no one be deceived into thinking you are becoming rich. But we are enriching the lives of a lot of people who otherwise would not have people who care for them caring for them. Absolutely. And so this is one of those fights that we have to win, because if we don't, the well-being of California will be deteriorated. And so that's why this is one where it's great to have warriors like this with you. You got to win this.